Hi guys, welcome back to MedNuggets podcast. We are back with another episode on a topic you all suggested to us. So in this episode, we will be answering 4 questions you asked us about Ozempic, which are: what is Ozempic? Can I take Ozempic for weight loss? Is it a tablet or an injection? And for how long are you supposed to take it? And are there any side effects of this drug? So let's start with question number 1, which is: what is Ozempic? Ozempic is a drug that is approved by the FDA for the treatment of diabetes. It not only reduces blood sugar levels in diabetic patients, but it also lowers their risk for cardiovascular events like heart attacks and strokes. So the active compound in this drug is called semaglutide. Even though Ozempic is not specifically labeled as a weight loss drug, the active compound semaglutide, which is in Ozempic, can cause weight loss when given in high doses. So if you want to lose weight, it's not Ozempic that you should take, but Wegovy, because Wegovy is another drug that contains a higher dose of semaglutide, the same compound in Ozempic, but remember Ozempic had a lower concentration of this compound, right?
Yeah. So there are 2 ways by which Wegovy acts and it causes weight loss. One of the ways is that it signals the hunger centers in your brain, to be more specific, your hypothalamus, to reduce hunger, your appetite and cravings. The second mechanism is by slowing the rate by which your stomach empties. So basically keeping you full for a longer period of time after you eat. So by these 2 mechanisms, it can cause you to lose weight. Another important thing you must remember is that Ozempic is covered by insurance, but Wegovy is not covered by insurance.
Yeah. Question number 2. Can I take Ozempic for weight loss? So let me tell you what the FDA thinks about this drug first. According to the FDA, people who are overweight or obese can use Wegovy. So by overweight or obese, I mean people with a BMI of more than or equal to 30 and people with a BMI of 27 or more, plus other health problems like high blood pressure, diabetes, or high levels of cholesterol, those kind of people.
Yeah, so can a person who is overweight a little bit but does not have underlying health problems, can they use this drug to lose that weight? It's best to not use this drug, because people who are overweight and has health problems, they have a greater risk of developing conditions like heart attack and stroke, right? So this drug is recommended for people who are overweight and has health problems. But if you take a normal overweight person who doesn't have any health problems, they don't necessarily have that big of a risk of getting a stroke or a heart attack, right? So they don't need Wegovy. They can use diet and exercise to lose that weight.
Yeah. And another question that you asked us is that is Wegovy a tablet or an injection, and for how long are you supposed to take them?
Yeah.
So Wegovy and Ozempic, they are both injections, and they should be injected once a week. But there's also this tablet form of semaglutide called Rybelsus, and that's for people with diabetes, and this tablet form should be taken every day. And for how long should you take these drugs? As with many chronic conditions like high blood pressure and diabetes, you must take these medications for the rest of your life if you want to see results. But then again, sometimes people can stop using some chronic medications by making significant changes to their lifestyle, like by eating a healthy diet and by exercise, right? So it actually depends on your situation. If you can maintain a healthy weight by diet and exercise, your doctor might be able to take you off these medications, right? Right, Vinuri?
Yeah.
But then again, this is something you should do with medical advice.
Yeah. And a big problem with these drugs, Wegovy-like drugs, is that the moment you stop taking this drug, you will start regaining all that weight you lost all of a sudden. And it can even worsen chronic conditions like diabetes. And just like any other drug, Ozempic and Wegovy, they also have side effects.
Yeah.
So the most common side effects reported are mostly gastrointestinal symptoms like nausea, vomiting, diarrhea, constipation, abdominal pain, indigestion, bloating, gas, and also headache and fatigue have also been reported.
Yeah, and another devastating side effect that has been reported is retinopathy. During a clinical trial for Ozempic, a small proportion of people have developed new or worsening retinopathy. So, which brings us to the question, what is retinopathy? So, retinopathy is an eye condition that people with uncontrolled diabetes can develop. It's a complication of diabetes where the high blood sugar levels can damage the blood vessels in your eyes and cause loss of vision or even blindness. So if you are someone with diabetes, you should definitely talk to your doctor before you start these drugs.
Yeah.
And also Ozempic can cause thyroid tumors, even thyroid gland cancers. So if you get a lump or swelling in your neck while using this drug, you should consult your doctor immediately. And if you or any of your family members have thyroid cancer, then don't use this drug. And also if you have a condition called MEN, which is also known as multiple endocrine neoplasia, then don't use this drug, because MEN can cause thyroid tumors, which can worsen if you take this drug, right?
Yeah. So, a quick summary about why you might want to think twice before starting Ozempic or Wegovy for weight loss is firstly because these drugs are not for everyone.
Yeah.
So, Ozempic is a drug that is given to people with diabetes, and Wegovy is only given to people with a BMI of more than or equal to 30, or to people with a BMI of greater than or equal to 27 with underlying health problems.
And if you start Wegovy or Ozempic, it's for life. It's a lifetime subscription. It's kind of like, you can't cancel it. It's kind of like marrying someone, right?
Yeah.
So if you stop it, you'll regain all the weight you lost very quickly.
Yeah, and also because these drugs are very popular and a lot of people are using it, there is an shortage of these drugs at the moment. So people who really need it, people with legit problems like diabetes, they will not be able to get access to this drug.
Yeah. And also, as we mentioned before, these drugs, they can cause some serious side effects like thyroid cancer, retinopathy, and stuff like that, right?
Yeah, and even though it's only in a small proportion of people, but these studies have not had long-term follow-ups, and these studies had only a small sample size. So anyone can get it.
Yeah. And these drugs are expensive. The insurance doesn't cover Wegovy,
Yeah,
right?
only Ozempic.
Only Ozempic.
And even though these drugs, they can suppress your cravings and your appetite, you still need to cut down on sugary foods and fatty foods. And you need to make sure you work out to maintain that healthy body weight. Don't expect you to magically lose weight with these injections without making any lifestyle changes, right?
Yeah. All right, guys. So that brings us to the end of our podcast. Have a great day, and we'll see you soon.
Yeah, bye-bye.
Bye-bye.